In this video, we're going to talk about physical therapy exercises for hip impingement and why they often don't work. I'm Matt Shu from Upright Health, and I'm joined today by my buddy
Shane from GotRom.com.
Together we created the FAI Fix a few years ago to help people who were diagnosed with FAI or hip impingement. And in this video we wanted to take some time to explain why physical therapy exercises for hip impingement often don't work and what you can do to make sure you're on the right track when you're trying to retrain your hips to stop hurting. So we're going to go over 3 major points, and at the end of the video we're going to talk about what you can do to make sure you're on the right track. The first major problem that we've seen with a lot of physical therapy protocols for hip impingement is that the treatments are really passive, too passive. So for example, in a couple of protocols that we've seen, one really popular exercise is actually one in which Shane is doing absolutely nothing as the hip pain sufferer. The therapist just grabs the leg and tries to traction the femur out of the socket. Shane, how's that feel?
Relaxing.
Are you doing anything?
Nope.
Are you learning how to control this position?
Nope.
So all that's happening is Shane is lying there for 2 to 3 minutes while I'm pulling on his leg. Now the rationale behind this is that somehow this is going to keep his femur pulled more out of the socket so that he has more room. But as soon as Shane goes to standing, whatever we did is not going to last. If it were actually that easy to get the femur to stay out of the socket just by pulling, we'd have a whole lot more traumatic femur dislocations out there in the world. So this type of passive treatment, whether it's somebody pulling on you or somebody just constantly massaging you and just having you lie there, is not the way to gain control of your hips so that your hips are pain-free. The second major problem that we've seen is that the difficulty levels of exercises in physical therapy programs are often way out of line with individual needs. So one of the things we've seen is an exercise called the rear lunge with a tap of a ball in front of you. So Shane's going to demonstrate. This is actually in a program that we've looked at where somebody with hip pain is being asked to perform a fairly complex hip exercise in order to retrain their hips to feel better. Now there's a couple problems when you start doing an exercise this difficult. Number one is Shane's doing the exercise on one leg and going through a pretty big range of motion while also having to focus on other body parts. So it makes it difficult for him to focus on using the correct muscles. And Shane, let me have you do this one more time. For different people, this type of exercise is going to challenge different muscle groups. So for some people who are really good at doing squats with their quads, they may end up using their quads even more in a way that starts to cause more discomfort in their hips. Now that could be avoided if you choose better exercises that are more suitable for your competency and your strength levels.
So it's not that this is a bad exercise. It could be a progression for someone, but it probably shouldn't be the very first progression. For example, there's things that are a lot more stable and there's just one thing to focus on, like just a split squat would be a much more appropriate beginner level progression, followed by maybe a reverse lunge where there's 2 points of contact with my feet, some stability, I can control it, and then maybe eventually this version that we showed, but it probably shouldn't be the very first progression.
The third problem that we see in physical therapy is that cookie cutter programs are being used for everyone just because they have the hip impingement diagnosis. The problem is every individual has specific challenges that are specific to them. So for example, if Shane was the guy we were working with and his hamstrings locked up here and he couldn't raise his leg beyond there, we would want to treat this differently. We'd want to train him differently than if Shane came in and said, yeah, I can get all the way here. These are 2 very different people and they shouldn't be training the same way. So that's why in the FAI Fix program we have a scenario 1 and a scenario 2, and we have a number of self-tests to help people identify what their specific limitations are so that they can train their own bodies in the way their bodies need to be trained.
It's also important to note that someone can switch scenarios, meaning they can start out stiff and tight and immobile like I was, which is what we call scenario 1 in the program. And over time, they can gain back their mobility and range of motion, which I've done. Now I'm almost more scenario 2, where I'm hypermobile or very flexible, and the approaches that I need now to just kind of maintain what I've gained and to feel good are a little bit different. I do a little bit more stability and strength training now, as opposed to a lot of tissue work and stretching and mobility work in the past.
So if you're trying to retrain your hips and you've been told you have hip impingement, then there are 3 things you need to remember. Whatever you're doing, you need to be taking an active role in the process of retraining your hips. So if you're working with a therapist who's telling you all you need to do is just lie there, then you probably want to find somebody different. If you are doing exercises that feel like they are too hard for you, and they may even be reducing your range of motion and making things worse, then you need to make sure that you're adjusting the difficulty level so that it's appropriate for you. And finally, you need to make sure that whatever program you are using, whatever training protocols somebody's recommending for you, that they're really tailored to you and your challenges. Cookie cutter approaches that don't allow for individual variability just don't work when you're trying to help your hip joint move more freely. So keep those things in mind when you're retraining your hips, and that will take you a long, long way. If you're looking for ideas, looking for helpful links, be sure to check out the description box. And as always, please remember that pain sucks.
Life shouldn't.